Dr. Marie, and I'm going to be taking care of you today.
Hi, doctor. I think my kidney are injured.
That's right. You have acute kidney injury.
But why did this happen to me?
Well, let me explain the pathophysiology of acute kidney injury to you. This happens when you have a rapid loss of kidney function and a rise in serum creatinine and/or a reduction in urine output. There are three types of acute kidney injury. There is prerenal, when there is a decrease in blood flow that leads to decreased glomerular perfusion and filtration of the kidneys. There is intrarenal, which happens when there is a condition that causes direct damage to the kidney tissue, resulting in impaired nephron function. And finally, there's postrenal, when there is a mechanical obstruction in the outflow of urine. And as the flow of the urine is obstructed, urine refluxes back into the renal pelvis, impairing kidney function.
But why me, doctor?
Well, prerenal injuries are caused from things like dehydration, hemorrhage, and burns. Intrarenal injuries are caused from certain drugs, contrast media, and infections. And postrenal injuries are caused from things like renal calculi formation. But this happened to you because you are a part of an at-risk population. You are an older adult who is hospitalized. Because you are an older adult who is in the hospital, you are more at risk for consuming medication that can damage your kidney, leading to intrarenal acute injury.
I hate being so old. So, do you think because my kidney are injured, that's why I have all these clinical manifestations?
Yeah, that's right. Can you tell me what you are experiencing right now?
Well, right now I'm in the oliguric phase. My urine output is less than 400 ml per day. My UA shows cast red blood cells and white blood cells. My urine specific gravity is 1.01 and my urine osmolarity is 300. I have fluid overload. My neck veins are distended. I have bounding pulses, severe acidosis, casmo respiration, low serum sodium, hyperkalemia, elevated BUN, fatigue, and difficult concentrating. At least I'm not having seizure, stupor, or in a coma.
Wow, Na, I'm really impressed.
Knock, knock. I couldn't help but overhear your talk.
Hi, this is Steph. She'll be your nurse. I'll
Hi,
let you take
Steph.
over from
Hi,
here.
Na. I also wanted to point out that soon you'll go into a diuretic phase, where you'll have a daily urine output of around 1 to 3 liters, which may last at least 1 to 3 weeks. And after that, there is a recovery phase, where your GFR increases and your BUN and your creatinine decrease. It still may take up to 12 months for you to stabilize.
Wow.
Now it's time for you to have your diagnostic test done. Today you're going to have a CT scan, a renal scan, a renal ultrasound, urinalysis, serum electrolytes, serum creatinine, and BUN drawn. And we're going to identify the underlying cause of your illness.
Okay, sounds good.
Oh look, there's a commercial right about kidney injury. Let's watch first.
Okay.
Do you have acute kidney injury and the NANDA nursing diagnosis of excess fluid volume related to decreased kidney function and fluid retention? If so, you need to watch this. There are some very new and exciting treatments modalities coming in the very near future just for you. First, we're going to treat your underlying cause. Then we're going to we're not going to give you any more fluids. And then we're going to lower your potassium level with some calcium supplements and some phosphate binding agents. You'll also get enteral and parenteral nutrition. And then we're going to give you dialysis. Doesn't that sound great? You're going to be like new in no time. In addition to these treatments, you'll also have your very own personalized nurse who will take really good care of you. Don't worry. The nurse is going to do the following nursing interventions. She's going to accurately record your intake and your output, your pee, and that's going to be done every shift. They're going to weigh you at the same scale at the same time every day, and then monitor for signs and symptoms of hypervolemia every shift. Doesn't that just sound so great? You'll never want to leave. The care is going to be so good. So call us at 555-555 to pre-order your nursing care plan now.
Hello, I'm
Hi.
Sabrina. I'm your nurse today.
Nice meeting you, Sabrina.
Nice to meet you. It looks like you're ready to go home.
Yes, I am.
Okay, perfect. We just have some teaching to go over, okay?
Okay.
So as you know, being an older adult, you're susceptible to acute kidney injury.
Yes.
Also, dehydration is a predisposing factor and tends to occur much more often in older adults.
Mm-hmm.
When you get home, make sure to watch out for signs of dehydration,
Okay.
such as dry or wrinkled skin, dry oral mucous membranes, a furrowed tongue, decreased urine output, and concentrated or dark urine.
Okay.
Since you're being discharged with many new medications, you'll definitely want to keep an eye on your urine output. Okay? Since your medications are potentially nephrotoxic, you must monitor your kidney function. Also, be careful about abuse of over-the-counter analgesics, especially non-steroidal anti-inflammatory drugs, because some of these can worsen your kidney function. Some other potential nephrotoxic drugs include antibiotics like bacitracin, cephalosporins, gentamicin, and vancomycin. Gold and heavy metals, captopril, tegamet, lithium, cocaine, and heroin can also be nephrotoxic. So stay away from the hard stuff.
Yes. Okay, sounds good. What if I need some support group when I'm recovering?
Oh, that's a great question. I do have some community resources available
Okay,
for
good.
you. That's in the area where you live.
Oh, okay.
So Santa Clara Valley Medical Center has a renal care center in San Jose. Also, Stanford has an adult kidney pre and post transport support group in Palo Alto. Also, the National Kidney Foundation is holding a kidney walk very shortly. A support group for people living with kidney disease is also available in San Mateo. I'm sure you'll find something that works great with you.
Okay, thank you. I think I'm ready to go home.
Great.